Hi, I'm Dr. Stephen Stokes, Advanced Pain Solutions in Fort Myers, Florida. And today I'm going to talk about Hako-Med. I have several Hako-Meds in the office. I've used them for over 10 years. It's the most effective modality for eliminating pain quickly without drugs or injections. And it's the absolute best modality for rehabilitating injured peripheral nerves that we see in things like diabetic neuropathy. No question, works stellar. I'm going to include all the research articles down below with links so you can copy those, print them off, do what you want with them, and you can get all the background. I'm not going to spend time right now convincing you that this machine works. You're going to have to do that on your own. I assume you already have a machine. The second-hand units like these units are fabulous. I think they're worth under $10,000, I think is a good price for these machines. And if you have one, you've already realized that there's a lot to it and you may not know how to use it. Unfortunately, there's not a lot of good material out there on using it. There is a manual that comes with it and it's very sparse. There is also a treatment manual, and if you use the treatment manual, you're not going to get good results. That's my clinical experience. You have to go beyond that, and here's why. This is not a microcurrent machine and it's not a TENS unit, and you can't use it like that. You have to use it differently. And so first and foremost, I want to explain to you that the secret to Hako-Med is its ability to produce a middle frequency. A middle frequency means between, in this case, 4,000 to 20,000 hertz, or beats per second. Now, a typical TENS unit uses up to 200 hertz, which is fine. It helps. It can help with pain. It helps with pain the same way that if you bump your elbow and you rub your elbow, you feel the rubbing and not the pain. So there is some benefit to that. But Hako-Med uses frequencies much higher, what are called middle frequencies. When you expose the body to frequencies in the thousands, what happens is that it begins to burn up a chemical called CAMP. And CAMP is a modulator for pain. So with the Hako-Med, if you use it correctly, this will be as effective as a steroid injection for relieving inflammation. It'll be as effective as a lidocaine injection for relieving pain. This has the ability to replace those more invasive procedures in your clinic if you use it correctly. So, first and foremost, we want to use middle frequencies for pain. And what we want to do is, when we have a patient present, we want to take the first 2 weeks of that treatment plan and see the patient ideally every day. And we want to use middle frequency. So to keep it simple, if you go to your pre-programs, if you type in 1, 5, enter, number 15, that will give you 4,000 hertz, and that's a great place to start. So when you have a patient, you use a number 15. It's preset for 15 minutes. Now, the research on the machine shows that the optimal time is 20 minutes. So you can go into your machine if you want to your ability to program your own programs, make your own programs. And you can set up, like I have, programs, custom programs that run for 20 minutes. But for now, the simple thing is just use the preset 15. If you have the ability to use a 30-minute, then use 30 minutes. But just realize that optimal is 20. So if you're running a 30-minute program, you're really going about 10 minutes too much. You're still going to get benefit, but not as much. So that middle frequency, number 15, that's going to burn up the CAMP almost completely within 20 minutes. That's going to give your patient immediate pain relief and over time allow those tissues to heal. So you're going to run a number 15 for 2 weeks every day. At the end of that 2-week period, there should be improvement. If there's no improvement in the 2-week period and you've been running number 15 every day for 20 minutes, it's not working and you have to move on. But if you're getting at least 30 to 50% improvement in the first 2 weeks, it's working. Then what you want to do is you want to start to combine middle frequency, which again is for pain relief and healing, with low frequency for stimulation, for rehabilitating, for strengthening the nerve. And on your program, the best setting for that, for nerve rehabilitation, is a number 19. Put in 19. Number 19 is going to use all sorts of low frequencies in modulation to cause the muscles to contract, to twitch, to activate motor points, and it's going to really wake up that nerve. And so what I do is, after the 2 weeks of seeing the patient daily on a number 15 setting, I will then start to combine treatments. I will, for example, do 10 minutes of number 15, which is 4,000 hertz, combined with 10 minutes of number 19. So they'll get a combination of both, and that works really well. If a patient comes into the office and they have complete numbness, so their main complaint is just numbness. Doc, I can't feel anything in my feet. the temptation among practitioners is going to be to use the number 19 setting, which is low frequency, so that the patient can really get a hammering down there to wake up those nerves and get some muscle twitching. It's the wrong thing to do. No matter what, always take your first 2 weeks and use middle frequency. Middle frequency will go in there and clean up. It will clean up the inflammation. It will clean up all those nasty little problems that are around the nerve, that are going to prevent it from responding to the nerve rehab. So regardless, you want to start off with middle frequency and then move into lower frequency once they start to respond. That's your basic. Where do you put the pads? Where do you put the cups? Well, surround the area of the complaint. That's the easiest. If you use just 2 pads, it's superficial nerves. If you use 4 pads in a crisscross manner, meaning that you're going to use red and red, white and white, the focus of the treatment is going to be in the center of that, and it's going to go very deep. The way I work it is that I take every patient and divide them up into 4 categories: cervical plexus, brachial plexus, lumbar plexus, sacral plexus. And you can do your research and see where those nerves go and whatnot. And then, when I treat the patient, I just say, is it a cervical patient? Is it a brachial? Is it a lumbar? Or is it a sacral? And wherever they are, that's where I focus my Hako-Med. Now, there are neat things you can do if you know your anatomy. For example, if you have a patient with sciatic pain, you can take one of the pads or cups, put it between the ribs and the iliac crest on the opposite side of the pain, of the sciatica. Take another same color pad and put it under the gluteal fold, right where the sciatic nerve is there. And you can run the frequency in one side of the body. It'll pick up to the nerve because the nerve is going to be least resistance. It'll follow the sciatic nerve across and down the leg. You can run the frequencies right through the nerve if you know your anatomy, and that's really the most effective way to do it. So you can run that linear frequency right through the nerve. You can take the other 2 pads and crisscross them on the opposite sides, so you run a crisscross pattern. It's the best way to treat sciatica. In the information I'm providing below, you can read all about how to do that setup. But again, let's say you don't know any of that. Let's say you don't even know your anatomy very good. You just want to get the person out of pain. You say, Charlie, where does it hurt? Charlie says, it hurts, here. Fine. You take your cups or your pads, you surround it, you do a number 15, you blast it for 15 to 20 minutes, 20 being optimal. Boom. That person should have an immediate relief of pain because you're going to reduce CAMP. It's that easy. After that person starts feeling better, then you want to start to rehabilitate the nerves and reconnect the brain to the area. For that, we're going to use lower frequencies, like a number 19 setting, combined with middle frequency. So that's your basic approach right there. You have to learn your anatomy, and you have to tweak it and play with it. Here's a couple of other things, though. If you're using these cups, which are on the older machines, if you're using these, then make sure that every so often you unscrew your metal electrode out of the cups, clean them with alcohol, and then wipe them clean. Keep those clean, put them back in, get rid of all the grime that's going to accumulate from as the sponge breaks down. Make sure those are tight and secure. That is going to be a big problem if you don't keep those clean. The second thing is that with these sponges, if you're like me, you have a busy clinic, we're using these every day, you're going to want to clean these between patients. What I find the best thing to do is to have a little bottle like this of diluted alcohol and just spritz them in there and rinse them between patients. That works really well. And that's going to prevent bacteria from growing on the sponges and from you spreading anything with patients. A couple of other things with this machine is if you just go in here and press, let's clear everything out, if you just press S. When I press S, it gives me it says the immediate program, and it gives me a list: MF, ST, IF, scan, and C. So if you hit MF, then you're going to get a list of all your frequencies in middle frequency from 4,000 to 20,000. And so you can even go in here and try different frequencies, and they all have unique characteristics. The bottom line is that if you put a person on a number 15 program, and as you turn it up they say it hurts too much, go to a higher frequency. Go to a 12,000 hertz or go to a 20,000 hertz and use your manual to see where those are pre-programmed. The higher the hertz, the less the patient's going to feel and the less pain they're going to have while you administer the treatment. But if you're starting off and you're at 4,000 hertz and you turn it up and they say they feel it, keep turning it up. Keep turning it up, and as you turn it up until the patient says it's a little painful, then turn it down a smidge. That's how you want to set it. You do not want to set it like they suggest, which is just at threshold. You want to go beyond that. And then what's going to happen, it's really cool, is that after a few minutes of being at that intensity, the patient's going to go, hey, doc, I don't feel this anymore. Then you know you've burned up that CAMP. So then you go in and you turn it up a little more, and you turn it up a little more, and you keep goosing it up a little bit during the 20 minutes to continue to go deeper and burn up more CAMP. That's the way to use it, and it works so good in my office. It's so good. I do laser, VAX-D, PEMF. I do manual therapy. We do massage. We do rolfing. We do myofascial release. We do chiropractic adjusting. I do so many things. This is the ticket. Somebody walks in the door and they're all humped over and they're in a lot of pain. I'm not adjusting them. I'm not even putting them on a VAX-D spinal decompression table. They're getting on this thing for 20 minutes on a number 15 setting, and I'm just going to continue to goose that up and burn up the CAMP. When I'm done, they're going to get up, they're going to feel better. I know they're going to feel better. It's going to give them confidence in what I do, and it's going to be a great part of the program. And then after about 2 weeks of running my middle frequencies, I'm going to then switch over to lower frequencies to rehabilitate the nerve. So it's the way to do it, right? Now, I want to explain one more thing. This device has a unique program in it called Diascan Scan. Again, if you go to S, get your list, and you hit scan, you'll see it says scan or Diascan. Okay, here's what that is. Diascan means that you put the pads on the patient and you start turning up the frequency. You have 30 seconds to establish the patient's tolerance. So you turn it up until the patient says, oh, it's kind of hurting. You turn it down a little bit. They say it's comfortable. That's where you are. You do that within 30 seconds of being on Diascan, and at 30 seconds, the computer locks you in at that level. Now, that establishes the baseline for how the computer is going to treat the patient. And then, here's the great thing. What Diascan is going to do is it's going to start at 4,000 hertz, and it's going to run up 4,000, 5,000, 6,000. It's going to run all the middle frequencies up to the top, pause, and then run them all the way back down in reverse. And it's going to do that for the whole program. It's going to scan all the frequencies to clear out the CAMP and to clear out all the little idiosyncrasies in between that the nerve may like. I mean, the nerve may like 6,600 hertz. If you're just blasting it at 4,000 all the time, you're going to get results, but you may be missing out a bit. So the Diascan really clears out everything, and it's a fabulous program to use. The problem with it is you really have to be careful in setting the threshold. If you don't set it high enough, the patient gets discouraged. I don't feel anything. If you set it too high, as it goes up and down, they're going to have pain. So you've got to really understand how to set the thresholds, but Diascan is also a great program. Remember with Diascan that you're getting all of these intermediate frequencies. So what's going to happen is like the patient may really respond to, say, 5,500, and when it hits that, they're going to really get a different feel than they're going to get at 10,000 or whatever. So as it's scanning, the patient may report, I don't really feel it that much. Or they may say, well, I'm feeling it more now, it's changing. And you say to them, that's perfect. That's the computer scanning your nerves, and that's the relationship, the biofeedback relationship between the computer and your body. Higher frequencies need more intensity so the patient can feel it. In other words, if you are increasing frequencies from 4,000 to 20,000, and as you're increasing the frequency, you're not also turning up the intensity or the power, then the patient's not going to feel anything. Because at the higher frequencies, we need more power, more juice to drive the electricity into the body. Diascan does that. As the Diascan increases in frequency, right, it also increases in intensity based on the baseline you put in, which is phenomenal. So that's why Diascan is so neat. Now, the other option, the scan option, does the same thing. But with scan, you're not increasing the intensity as you increase the frequency. So you're not going to have the same push. As it goes from 4,000, 6,000, 7,000, and the frequency goes up, scan does not equally bring up the intensity. And why would you use that? Sensitive patients, fibromyalgia patients, those patients may not do well with a fluctuation in intensity, but you still want them to get the different frequencies. You use a scan program. I'll use scan sometimes on the neck. A lot of times if I'm using Hako-Med treatment on the cervical plexus, which of course is like in this region here, mid-neck, man, this stuff is so sensitive that I can hardly use any energy at all, and I'm getting twitching. And I don't want all this twitching if I'm using middle frequency. I do want twitching if I'm using a number 19 for rehab, but in the first 2 weeks, I'm not doing that. So how do I get so that I can get the treatment in there and not get the twitching? Simple. I either use a scan if I'm scanning. I use a scan, not a Diascan, or I go in there and I use, instead of 4,000 hertz, like a number 15, I'm using a 12,000, or I'm using a 20,000. I'm using higher hertz. If I put 20,000 hertz into the cervical plexus here behind the SCM, they're not going to get any twitching at all. If I use 4,000 hertz behind the SCM, they're probably going to get some twitching, which is not optimal. We don't want to use up energy to create motor point activation when we're trying to burn off CAMP at middle frequencies. So, another few things about it is that if you have a vasopneumatic device like I do here on the bottom, then it's got minimum, maximum. It has pulsation rate. It's all in here. I always use maximum, and I don't pulsate it. I don't modulate it at all, because it's just going to screw up your electrical treatment. If it's modulating and sucking on the person's leg or back, then when it goes to suck, it's going to increase the intensity of the treatment, and then when it doesn't suck, it's going to decrease it. It just screws with it. There's no need to do that. Keep it on maximum so you can have a consistent treatment for the whole period of time. Again, read the articles I have below. They're going to really help. Understand your anatomy and understand how to run the currents through the nerves. These are all very important things. Run it through a nerve. So you're going to set, again, to do that, you're going to have 2 pads or 2 cups, like 2 whites. If I want to run it, for example, through the median nerve, I'm going to put, like, a pad here and like a pad here, right? I'm going to run it through there. And then what I want to do is put pads on either side of that nerve to run across an interference. And just like in the sciatic setup that I have listed below, that's how you want to do it. And it's stellar, man. It's a great machine. Like I said, I have 3 of them. There they are. 3 of them. I have 2 of the units, the 4 channels. I'm sorry, the 2 channels with the 2 channel units, which have, each channel has 4 leads, so 8 leads. And I have even one of the older units, which is the Pro Elect DT Horizon, which is only 1 channel, 4 leads. I still have it. I've had it for 10 years or something, man. It works great. So hopefully this helps to just define with you how to use the machine properly. Best thing to do is email me or call me on the phone, and we can discuss it if you're having more problems with it, so I can straighten it out for you. Just stick to that and you'll be okay. Now, if you want to get into how to program these machines, you got to use your manual. Your manual will guide you step by step. So what you should do is this. You should set up a couple of programs in your custom mode. You should have, first of all, like a program that allows you to do 4,000 hertz at 20 minutes. Then you should have one that does, say, 10,000 hertz at 20 minutes, and then one that does, say, 20,000 hertz at 20 minutes. So you've got a variety of ones to pick from depending on what the patient likes. You should also have a program that gives you Diascan for 20 minutes. So those are your first 2 weeks treatments for any patient that comes in your office. You're going to pick from those. Then you should program for the second 2 to 4 weeks. And for those patients that have already achieved some success and you want to start to rehabilitate the nerve and return some of the sensation that's gone from peripheral damage, like numbness in the toes and stuff, now you're going to want to program 10 minutes of middle frequency, either 4,000, 10,000, 20,000 or Diascan, coupled with 10 minutes of program number 19, which is stimulation. And that's going to work really well. Someone says, well, what if I don't want to program anything? Can I just run 15 minutes, say, of 4,000, which is a number 15, and 15 minutes of number 19, which is low frequency? Can I do that for my patients after they've had 2 weeks? Yeah, it works perfect. No problem at all. You can do that and it'll work great. You don't have to program anything then, but I just like to customize it. I just like the idea of having custom programs. But you can do that as well. Remember, no matter what you're doing, optimal time on this machine per program is 20 minutes. Less than 20 minutes is less results. More than 20 minutes, you're still going to get results, but it's going to be at a slower rate, right? That's the key. So if you have a patient who has been to you for 2 weeks, you have been running a number 15 program at 4,000 hertz, they are feeling better. How are you feeling? Well, I'm definitely feeling better. How much better? I don't know, 40% better. It's working. That's the time when you switch over and you start to combine the programs. How do you do that? Easy. you can run a number 15 for 15 minutes, which is a number 15 program. At the end of the 15 minutes, you can switch it over and run a number 19 for 15 minutes, and you've covered your bases. Or you could run a number 15 program, which is the 4000 hertz, for 20 minutes, and then run the number 19 program, the lower frequency program, for the nerve rehab for 20 minutes. Because 20 minutes is the optimal time per program you're running. Hope that makes sense. Don't use it on anybody with a pacemaker, because you can't do that. Because if they have any problems, you're going to get in trouble. Anyone with electrical devices, you can't use electrical equipment on. Here is a caveat to that. The reality is that if you're using middle frequencies, meaning numbers in the 2, 3, 4, 5, 6,000 hertz range, studies show that pacemakers are not affected by that. So in theory, I could run middle frequency on a patient with a pacemaker and not have any problems. In theory. Do I do it? No, because I know that if anything happens, if that patient has heart trouble while they're on my machine, I'm going to get in trouble for it. But the research shows that middle frequencies are safe with pacemakers. Don't do it. And I'm not telling you to do it. I'm just letting you know that that's what the research shows. Because those middle frequencies, those hertz levels, beats per second of 4,000 to 20,000, they're too fast. They don't affect the pacemakers. So don't do it anyways, but just really have confidence in the equipment, have confidence in the technology, right? These machines will last forever. They're fabulous. You're going to have problems getting accessories, because Hako-Med doesn't want to sell accessories to anybody that hasn't spent $25,000 on a new machine. And most people out there who like myself, have machines. We've bought them all secondhand for between $5,000 and $10,000. Hako-Med won't deal with us. So where do I get, for example, these hoses? I get them from Synexus in Las Vegas. So Synexus makes a comparable machine. It's based on the same technology, Synexus, and those guys are awesome to deal with. And they'll sell me parts for a Synexus machine that I can use on my Hako-Med without any trouble at all. I get my electrodes from wholesaleelectrode.com. I get them real cheap, like I get them for under $2 for 4. I get these from China, from a cosmetic company out of China. I buy these in a sleeve. And I get this from Walmart. This is Walmart, right? And that's it. Also, you can contact, if you go online, you can get some electronics stores, and you can buy super long leads. This is like a 10-foot lead, I think. You can buy long leads if you use electrode pads that make it easier, so that you can, have the machine away from the patient while you're treating them. You can just pick these up. These are going to be this is a 6-prong, 6-pin electrode lead, like you would find on that's like something you would, 10 stores and stuff like that. Just get a long one. Hope that was helpful. Email me with any questions or give me a call.